Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about an important topic which is a mandibular nerve, which is always asked in the university examination, which is the branch of the fifth cranial nerve, which is the fifth cranial nerve name is trigeminal nerve. The third branch of the trigeminal nerve is known as mandibular nerve, which is the largest of the three. This trigeminal nerve generally divided into three types, which is first branch which is known as ophthalmic, second branch which is known as maxillary, and the third branch is known as mandibular. The third branch of the trigeminal nerve, which is the mandibular nerve, as I have written here, and which is the largest of the three. When we see the three, which is the maxillary, ophthalmic as well as mandibular, the mandibular branch of the trigeminal nerve is the largest one. And it is a mixed, it has both motor as well as sensory function. From brain to the sensory organ, there is a signal transmitted which is known as afferent fibers. From the sensory organ to the brain, the signal is transmitted which is known as efferent fibers. Both the functions are done by this mandibular nerve, so it is known as mixed nerve. The mandibular nerve is known as mixed nerve. The course of the mandibular nerve originates from the fifth cranial nerve. It originates from the fifth cranial, which is the trigeminal nerve, and it enters the foramen ovale. It enters the foramen ovale and comes out of the cranial cavity. Till here it was inside the cranial cavity. Now it comes outside of the cranial cavity. 2 to 3 millimeter. The nerve does not provide any branches, and then it divides into two. 2 to 3 millimeters. It does not provide any branches, and then it divides into two, which is small anterior division and large posterior division. These are the two divisions of the mandibular nerve. 2 to 3 millimeter undivided nerve. The 2 to 3 millimeter, when the nerve comes out of the foramen ovale, it doesn't gives branches 2 to 3 millimeters. That part of the area which is known as trunk. The branches. Now you will see the branches of the mandibular nerve. That's the course of the mandibular nerve. Now you will see about the branches of the mandibular nerve. The branches from trunk. The meningeal branch and nerve to medial pterygoid. There are two things, which is meningeal branch and the nerve to medial pterygoid comes from the trunk, which is the 2 to 3 millimeters, which comes out of the foramen cavity and united together to 2 to 3 millimeters and divided into two, which is anterior division as well as posterior division. That 2 to 3 millimeter area, which is known as trunk. From that trunk, that part of the area, there is two branches, which is known as meningeal branch as well as nerve to medial pterygoid. The meningeal branch, it enters the cranial cavity by the foramen spinosum. Again, it comes outside the mandibular nerve, comes outside by the foramen ovale. Now there is two branches, which is meningeal branch as well as nerve to medial pterygoid. The meningeal branch enters into the cranial cavity again by the foramen spinosum and supplies the meninges. This nerve to medial pterygoid supplies the medial pterygoid muscle. Now we will see about the small anterior trunk. There are four nerves, which is divided into four nerves: deep temporal nerve, buccal nerve, mesenteric nerve, lateral pterygoid. These are the four nerves. The deep temporal supplies the deep temporal area. Buccal nerve, which supplies the buccinator muscle. It is otherwise known as buccinator nerve. The mesenteric nerve supplies the mesenteric muscle, and the lateral pterygoid nerve supplies the lateral pterygoid muscle. These are the anterior division of the mandibular nerve. Now we will see about the posterior division: auriculotemporal nerve, lingual nerve, and inferior alveolar nerve. These three are the posterior division of the mandibular nerve. The auriculotemporal nerve supplies the auricle and the temporal area. The lingual nerve supplies the anterior 2/3 of the tongue. The tongue is divided into two, which is anterior 2/3 as well as posterior 1/3. The anterior 2/3 is supplied by the lingual nerve, and the posterior 1/3 is supplied by the glossopharyngeal nerve, which is the cranial nerve number 9. Inferior alveolar nerve supplies the mandibular teeth as well as alveolar sac. The inferior alveolar nerve supplies the mandibular teeth as well as the alveolar sac. This enters the mandibular foramen and divides into it, and it supplies the socket which holds the teeth, which is known as alveolar sac, and the teeth which are present in the mandible. Thank you. If you like this video, please to like, share and subscribe my YouTube channel. If you have any doubt in it, please to comment it. If you want any other topic, please to suggest in the comment box. Thank you. Please to subscribe.